Hello everyone. In this video, I will be sharing a high-yield review and update on lipid-lowering therapy PCSK9 inhibitors. PCSK9 therapy represents one of the most exciting areas in medicine advances. We will cover three generations from first-generation monoclonal antibodies to second-generation gene silencing small interfering RNA therapy, to third-generation furin protein therapeutic approach. As a quick refresher about how PCSK9 inhibitors work on a molecular level, PCSK9 is a protein that binds low-density lipoprotein LDL receptors on hepatocytes, targeting them for degradation. So mechanistically, when we inhibit PCSK9, whether with antibodies, RNA interference, or binding proteins, we increase LDL receptor recycling, dramatically lowering LDL-C levels, often referring to bad cholesterol. Fewer LDL receptors means higher circulating LDL cholesterol. First-generation PCSK9 inhibitors are monoclonal antibodies, PRALUENT, Alirocumab, and REPATHA, Evolocumab. Both agents were approved by the US FDA in 2015. They bound circulating PCSK9 and prevented from destroying LDL receptors. Second-generation PCSK9 inhibitor refers to small interfering RNA, siRNA therapy, LEQVIO, Inclisiran, which was approved by the US FDA in December 2021. Mechanistically, Inclisiran degrades PCSK9 messenger RNA, therefore reducing the PCSK9 production at the source. The latest third-generation PCSK9 inhibitor refers to Lerodalcibep, which was approved by the US FDA in December 2025. LEROCHOL is a recombinant furin protein therapeutics designed to bind PCSK9 with high affinity. Structurally, it's about half size of a monoclonal antibody and engineered for stability and prolonged action. Now, let's look at their pharmacokinetic PK profiles. Notably, all three generation agents are administered subcutaneously. PRALUENT, REPATHA, and LEROCHOL has very good bioavailability, ranging from 72 to 85%, except for LEQVIO. This agent has a relatively small volume of distribution, about a few liters, indicating that they are largely distributed in the circulatory system. LEQVIO has a large volume of distribution, approximately 500 liters. The half-lives of these monoclonal antibodies are generally long, about 2 to 3 weeks. Therefore, dosing for these monoclonal antibodies is every 2 weeks, every 4 weeks, or monthly, with rapid LDL reduction. In contrast, Inclisiran has a much shorter plasma half-life, approximately 9 hours, but it has a prolonged intracellular activity and therapeutic half-life in the liver. Therefore, the starting dose of LEQVIO is on day 0, 3 months. Then the maintenance dose is every 6 months with twice yearly dosing. LEROCHOL's half-life is 10 days. It's dosed once monthly. With regard to storage conditions, in general, monoclonal antibodies and furin protein products needs to be stored in a refrigerator 2 to 8 Celsius, but may be kept at room temperature in the original carton for up to 1 month for PRALUENT and REPATHA, and up to 3 months for LEROCHOL. LEQVIO is stored at a controlled temperature 20 to 25 Celsius. Now, let's dive into each medication in more detail. Alirocumab, brand name PRALUENT. This medication was initially approved by the US FDA on July 24, 2015, and currently indicated to reduce the risk of major adverse cardiovascular CV events, coronary heart disease death, myocardial infarction, stroke, or unstable angina requiring hospitalization in adults at increased risk for these events, as an adjunct to diet and exercise, to reduce low-density lipoprotein cholesterol, LDL-C, in adults with hypercholesterolemia, adults and pediatric patients aged 8 years and older with heterozygous familial hypercholesterolemia, HeFH, adults with homozygous familial hypercholesterolemia, HoFH. Chemically, Alirocumab is an injectable human IgG1 monoclonal antibody with a molecular weight of 146 kilodalton. PRALUENT is available as 75 mg per 1 milliliter or 150 mg per 1 milliliter in a single-dose pre-filled pen. With regard to storage and handling, given Alirocumab is a protein stored in a refrigerator at 2 to 8 Celsius, which is 36 to 46 Fahrenheit, in the original carton to protect from light. Do not freeze, do not shake. PRALUENT may be kept at room temperature up to 25 Celsius, 77 Fahrenheit, in the original carton for 30 days. If not used within the 30 days, discard PRALUENT accordingly. Depending on specific indications, recommended dosage for adult patients is 75 mg or 150 mg given as subcutaneous injection every 2 weeks or 300 mg every 4 weeks. Notably, for the 300 mg dosage, give 2 150 mg PRALUENT injections consecutively at 2 different injection sites. The recommended dosage of PRALUENT for pediatric patients with a body weight less than 50 kg, which is 110 pounds, is 150 mg once every 4 weeks, administered subcutaneously. For pediatric patients with a body weight of 50 kg or more, it's 300 mg once every 4 weeks. See prescribing information for dosing details. Mechanistically, this medication works as a PCSK9 inhibitor, preventing LDL-C receptor degradation and increasing LDL-C receptor recycling and expression, increase LDL-C uptake and therefore lower LDL-C levels in the circulation. Pharmacokinetically, Tmax, that's the median times to reach maximal serum concentrations, was 3 to 7 days following 75 to 300 mg subcutaneous dosing. The absolute bioavailability of Alirocumab was about 85% following subcutaneous administration. Further, based on intravenous administration studies, the volume of distribution of Alirocumab was about 0.04 to 0.05 liter per kilogram, indicating that it's largely distributed in the circulatory system. Its median apparent half-life at steady state was 17 to 20 days. Metabolism. Alirocumab is expected to be metabolized into small peptides and amino acid via catabolic pathways. Contraindications. History of a serious hypersensitivity reaction to Alirocumab or any of the excipients in PRALUENT. The most common adverse effects, greater than 5%, in adults with primary hypercholesterolemia, injection site reactions, and influenza. In patients with established CV disease, myalgia. Evolocumab, brand name REPATHA. This medication was initially approved by the US FDA on August 27, 2015, and currently indicated to reduce the risk of major adverse cardiovascular CV events, CV death, myocardial infarction, stroke, unstable angina requiring hospitalization, or coronary revascularization in adults at increased risk for these events. As an adjunct to diet and exercise to reduce low-density lipoprotein cholesterol, LDLC, in adults with hypercholesterolemia, adults and pediatric patients aged 10 years and older with heterozygous familial hypercholesterolemia, HeFH, adults and pediatric patients aged 10 years and older with homozygous familial hypercholesterolemia, HoFH. Chemically, Evolocumab is an injectable human IgG2 monoclonal antibody with an approximate molecular weight of 144 kilodalton. REPATHA is available as 140 mg per 1 ml solution in a pre-filled single-dose short-click auto-injector or in a pre-filled single-dose syringe, or 420 mg per 3.5 ml solution single-dose push-tronic system. With regard to storage and handling, given Evolocumab is a protein, store in a refrigerator at 2 to 8 Celsius, which is 36 to 46 Fahrenheit, in the original carton to protect from light. Do not freeze, do not shake. REPATHA may be kept at room temperature, 20 to 25 Celsius, 68 to 77 Fahrenheit, in the original carton for 30 days. If not used within the 30 days, discard REPATHA accordingly. Depending on specific indications, recommended dosage for adult patients is either 140 mg given as subcutaneous injection every 2 weeks or for 20 mg once monthly. For adults and pediatric patients aged 10 years and older with HoFH, the dosage can be increased to 420 mg every 2 weeks if needed. See full prescribing information for dosing details. Administer REPATHA subcutaneously into areas of abdomen, thigh, or upper arm. Rotate injection sites for each administration. Mechanistically, this medication works as a PCSK9 inhibitor, preventing LDLC receptor degradation and increasing LDLC receptor recycling and expression, increase LDLC uptake, and therefore lower LDLC levels in the circulation. Pharmacokinetically, Tmax, that's the median times to reach maximal serum concentrations, was 3 to 4 days, following 140 to 420 mg subcutaneous dosing. The estimated absolute bioavailability of Evolocumab was 72%. Based on intravenous administration studies, the mean volume of distribution of Evolocumab at steady state was approximately 3.3 liters, indicating that it's largely distributed in the circulatory system. The effective half-life of Evolocumab at steady state was 11 to 17 days. Metabolism, Evolocumab is expected to be metabolized into small peptides and amino acid via catabolic pathways. Contraindications: history of a serious hypersensitivity reaction to Evolocumab or any of the excipients in REPATHA. The most common adverse effects greater than 5% in adults with primary hypercholesterolemia, nasopharyngitis, upper respiratory tract infection, influenza, back pain, and injection site reactions. In patients with established CVD, diabetes mellitus, nasopharyngitis, and upper respiratory tract infection. Inclisiran, brand name LEQVIO. This medication was initially approved by the US FDA on December 22, 2021, and currently indicated as an adjunct to diet and exercise to reduce low-density lipoprotein cholesterol, LDL-C, in adults with hypercholesterolemia, in adults and pediatric patients aged 12 years and older with heterozygous familial hypercholesterolemia, HeFH, in pediatric patients aged 12 years and older with homozygous familial hypercholesterolemia, HoFH. Chemically, inclisiran is a chemically modified anti-lipemic small interfering ribonucleic acid siRNA in acetylgalactosamine GalNAc conjugate. LEQVIO is a second-generation PCSK9 inhibitor with the molecular weight of 17,285 daltons. Notably, the first-generation PCSK9 inhibitors are monoclonal antibodies such as PRALUENT and REPATHA, which were approved by the US FDA in 2015. The third-generation PCSK9 inhibitor, LEROCHOL, a fusion protein therapeutics, was approved by the US FDA in December 2025. LEQVIO is available as 284 mg per 1.5 milliliter, which is 189 mg per milliliter, in a single-dose pre-filled syringe for subcutaneous injection. With regard to storage and handling, store LEQVIO at controlled room temperature, 20 to 25 Celsius, which is 68 to 77 Fahrenheit, with allowable excursion between 15 and 30 Celsius, 59 to 86 Fahrenheit. Recommended dosage for adults and pediatric patients is 284 mg administered as a single subcutaneous injection initially, again at 3 months, then every 6 months. In addition, LEQVIO should be given by a healthcare professional. Mechanistically, this small interfering RNA medication works as a pro-protein convertase sublysine catalysin type 9 PCSK9 inhibitor. Specifically, the triatenaryl and acetylgalactosamine sugar moieties are designed and used to facilitate the hepatocyte uptake. Inclisiran works to selectively target the liver, utilize the RNA interference mechanism, causing the catalytic breakdown of PCSK9 mRNA. This leads to the increased LDL-C receptor recycling and expression, increased LDL-C uptake, and lowered LDL-C levels in the circulation. Pharmacokinetically, Tmax, that the median time to reach the maximal plasma concentration is about 4 hours. The apparent volume of distribution is about 500 liters. Protein binding is 87% based on in vitro studies. Metabolism. Inclisiran is expected to be metabolized into short nucleotide fragments within the liver by nucleases. The terminal elimination half-life is approximately 9 hours. Excretion. About 16% of inclisiran is excreted renally. Drug-drug interactions. No formal clinical drug-drug interaction studies have been conducted. Inclisiran is not a substrate, inhibitor, or inducer of cytochrome P450 enzymes or transporter. Contraindications: prior serious hypersensitivity to inclisiran or any of the excipients in LEQVIO. The most common adverse effects, greater than or equal to 3%, include injection site reaction, arthralgia, and bronchitis. Lerodalcibep, brand name LEROCHOL. This medication was approved by the US FDA on December 12, 2025, and indicated to reduce low-density lipoprotein cholesterol LDL-C in adults with hypercholesterolemia, including heterozygous familial hypercholesterolemia (HeFH), as an adjunct to diet and exercise. Chemically, LEROCHOL is a fusion protein therapeutics linked and engineered with the human serum albumin (HSA). LEROCHOL is considered a third-generation PCSK9 inhibitor. Specifically, the first-generation PCSK9 inhibitors are monoclonal antibodies such as Alirocumab and Evolocumab. The second-generation PCSK9 inhibitor includes Inclisiran, which is a small interfering RNA. The molecular weight for LEROCHOL is about 77 kilodalton. LEROCHOL is available as 300 mg per 1.2 milliliter, which is 250 mg per 1 milliliter in a single-dose prefilled syringe for subcutaneous injection. With regard to storage and handling, given LEROCHOL is a fusion protein product, store refrigerated at 2 Celsius to 8 Celsius, which is 36 to 46 Fahrenheit. Notably, if needed, LEROCHOL may be kept at room temperature up to 25 Celsius, 77 Fahrenheit, in the original carton for up to 3 months once being removed from the refrigerator. Also, given this is a protein therapeutic product, do not freeze, do not shake. Recommended dosage 300 mg subcutaneous injection once monthly. Mechanistically, this medication works as a protein convertase subtilisin casein type 9 PCSK9 inhibitor, preventing LDL-C receptor degradation and increasing LDL-C receptor recycling and expression, increase LDL-C uptake, and therefore lowering LDL-C levels in the circulation. Pharmacokinetically, Tmax, that's the median time to reach the maximal plasma concentration, is about 6 days. Following subcutaneous injection, the median bioavailability of Lerodalcibep is about 83%. Volume of distribution is about 5.3 liters. Metabolism is expected to be metabolized into small peptides and amino acid via catabolic pathways. Half-life is about 10 days, which justifies once monthly dosing. In addition, the extended long half-life is due to the fusion protein strategy with human serum albumin. Drug-drug interactions. No formal clinical drug interaction studies have been performed. Currently, there are no contraindications listed on the prescribing information. The most common adverse effects greater than or equal to 1% associated with LEROCHOL include injection site reactions, nasopharyngitis, diarrhea, nausea, and peripheral edema. Here are the key sources which I have used to prepare for today's video. The US FDA New Drug Approval Update is a very valuable resource. In addition, most of the medication information which I shared today is based on their respective prescribing information. These documents are available at the US FDA drug websites, along with the drug manufacturer websites. Finally, I want to thank you all so much for watching. If you find this video helpful, subscribe for future medication video updates. As always, keep learning and elevating. Thank you so much.